interventionist from the Marcus Autism Center in Atlanta, and I'm really excited to talk to you all today about early identification of autism spectrum disorder. So our objectives for this morning's webinar. First, it's for participants to gain information about normative social communication development in young children. And it's important to really go over and understand normative social communication development starting as early as just a couple of months old so that we can start to see when development goes a bit off track, if it's delayed, or if there truly is a divergence in development that we need to be concerned about. Second of all, participants will identify the core features of autism and early red flags in the first few years of life to gain a foundation for comparing these developmental trajectories in children with and without risk for autism. And finally, participants will understand the importance of early screening and detection of autism and the role of early intervention providers in this process. So first of all, what is autism? According to the DSM-5, autism spectrum disorder is delays and deviance in the development of social communication skills with the presence of restricted and/or repetitive behaviors present in the early developmental period. It's important to keep that in mind. These delays and deviances are present in the early developmental period, so we all need to be on the lookout from early on and looking for these early red flags as early as 9 to 12 months. For prevalence of autism, at this point, the most recent CDC report is 1 in 68. So for every 68 children who are born in the United States, one of them has autism. This prevalence is higher in boys. It's 1 in 42 boys, whereas in girls, it's 1 in 189. And as you can see from this graphic, the prevalence is certainly on the rise. And I'll talk about that in just a couple of slides. So when we're comparing autism to other common pediatric diseases and conditions that we hear about, you can see, as we discussed just a moment ago, autism spectrum disorder has a prevalence rate of 1 in 68. And that's a higher prevalence than things like childhood cancer or juvenile diabetes or cystic fibrosis. So it's certainly something that we have an ethical imperative to be paying attention to and to be looking into identifying it earlier and thinking of cost-effective and usable interventions. So as I alluded to before, there has certainly been an increase in prevalence, and there's really certainly several different reasons, we could say, for this increase in prevalence. It's not just one thing. First of all, there certainly have been changes in diagnostic symptomatology. So there's been a broadening of criteria. And this truly is just us understanding autism more and more so that we're able to really capture children who have autism, who we maybe didn't call that autism before. We now know that that is autism. So we're having better detection at both ends of the spectrum. For example, in what would be considered a lower functioning child, that child might have not gotten a diagnosis of autism before because there were other things muddying up the water, such as a cognitive delay. But we're able now to really parse out what is autism and be able to address those needs in children, whether they're lower or high functioning. There certainly has been more growing awareness of the condition. There's increased media attention, good and bad, but certainly increased media attention that has people paying attention to and having increased awareness of what autism is. There are also educational implications of the label. Parents are learning now that if their child has this diagnosis of autism, they might be able to get some more services potentially in the school system, or now with some of our insurance mandates across the country, they're able to get services that they need with that diagnosis. So they might be a little more likely to pursue that diagnosis in order to get the services that their child needs. And then certainly diagnostic substitution. So what might have been in the past called something, a child might get a diagnosis of oppositional defiant, or they might get a diagnosis of ADHD. They might go through lots and lots of different diagnoses before they actually finally get to autism spectrum disorder. And again, this goes back to us having more of an understanding of what autism is now. So if we can better identify autism, we can better really address the needs of that diagnosis. In terms of the challenge of autism spectrum disorder, we know that intervention has the greatest impact on autism if it begins before 3 years of age. So early intervention is truly imperative to address autism spectrum disorder. But unfortunately, 80% of children who need early intervention are missed. And this is very, very unfortunate. And this is why we all, as early childhood providers, people who are interacting with children on a daily basis, really need to be on the front line of addressing this need. Pediatricians certainly do as well, and the American Academy of Pediatrics recommends screening for autism at both 18 and 24 months. But keep in mind that this is a recommendation, that this screening occurs, and it doesn't always. So we can't depend on pediatricians to be this frontline provider and be the only frontline provider in identifying autism. We also know that research has shown that parents of children with autism are noticing a developmental problem before their child's first birthday. So parents, now oftentimes this is retrospective, a parent thinking back, but if parents are having these concerns as early as 12 months, and then this first screening isn't happening until 18 months, well, that's potentially 6 months of a parent's concern with nothing happening to really intervene with that child and potentially get them the help that they need in order to promote their development. So as I just mentioned, the caregivers and early providers are truly the frontline providers to have success at early screening and detection. So everyone really needs to view themselves as much of an expert as they can be, to alert caregivers to be someone who is really noticing these delays and able to get children the referrals that they need and get them the support that they need. So in order to truly understand the earliest red flags of autism, we very much need to delve into social communication developmental milestones, and we need to start early. So you'll notice that in this presentation today, I'm starting as early as 2 months. I feel that it's very important that we see how children are falling in love with the social world from the day they come onto this earth. So it's important that we understand that. The milestones that I'll be discussing today are from Learn the Signs Act Early, the CDC campaign that is accessible for anyone online. Parents can access these resources, and they're very helpful for understanding development really across the board. So starting at 2 months, it's interesting to think about social communication development starting so early, but if you spend some time with a 2-month-old, I think you'll certainly see that is the case, that we're having a 2-month-old being interested in people and interested in faces. So milestones in terms of social communication development that we'd see at this early would be that a baby is even starting to have a little bit of self-regulation, self-emotional regulation, where they can briefly calm him or herself, maybe putting their fingers to their mouth and getting themselves calmed down just a little bit without too much assistance, but still mostly needing assistance from parents to calm down. They're starting to smile at people, so that social smile is starting to come on board. That tends to happen around 6 weeks of age. So we go from that reflexive smile before that might have just been gas or something like that, to truly wanting to smile at people and being interested in people. So a 2-month-old is starting to pay more attention to faces and notice faces and be more interested in faces. A 2-month-old is starting to play with their voice just a little bit, starting to get a little bit of control, some cooing sounds and some gurgling sounds to play with their voice. And they're turning their head toward sounds and starting to follow things with their eyes and recognize people at a little bit of a distance. So the baby or the newborn really is moving from, what is right in front of my face. Okay, I'm a little interested in my environment and what I can kind of see and process. But in thinking about that environment, even a 2-month-old is going to be more interested in people than objects at this stage. A 4-month-old is going to be a 4-month-old, again, as I mentioned with the 2-month-old of watching faces and being interested in faces, a 4-month-old is really, really interested in faces and watching them closely. And again, if you spend some time with a 4-month-old, you'll notice they're looking at your eyes and they're looking at your mouth and maybe even trying to copy some of those movements and facial expressions. So again, at just 4 months of age, they are really in love with people and just so interested in people. That's the most interesting thing in their lives. So they're even at that early of a stage wanting to imitate some of those movements and facial expressions. The social smile is absolutely online at this point, and a 4-month-old will spontaneously smile and be very interested in smiling at people. A 4-month-old is beginning to babble, so again, getting a little bit more control even with their voice, starting to make some consonant vowel sounds just a little bit at this point. And again, being interested in the environment around them, they're starting to reach for toys with one hand. Now, this reach to grab is what does eventually, in a few months, turn into that, reach to indicate, where they're saying, someone can help me. I can reach out and someone might help me get that. I'm not going to just try to grab it, but it's truly a reach gesture. So again, as early as 4 months, we're starting to see some of these gestures, pre-gestures kind of coming online, vocalizations coming online, and this just addiction to people, where we're really wanting to pay attention to people and even imitate. At 6 months, we've got a little bit of stranger danger coming on. So a 6-month-old is going to know familiar faces and begin to know if someone is a stranger. So have more of a preference towards looking at mommy's face and looking at daddy's face than looking at that stranger's face at Publix. A 6-month-old is going to start enjoying taking vocal turns with a caregiver. So this is really those pre-conversational skills of you make a sound, I make a sound, you make a sound, I make a sound, and being able to pay attention and notice when others are engaging a baby in a little bit of that back and forth and being interested in what's mommy's sounds, what is she going to say now, being interested in that. A 6-month-old certainly makes sounds to show joy and displeasure, really trying to use that voice to express themselves. And this is a very important one. As early as 6 months, we're seeing babies responding to their name. So, kind of jumping ahead a little bit, if we have a 3-year-old or a 2-year-old or a 5-year-old who is not yet responding to their name, that's a really big red flag because we know that a 6-month-old is going to be responsive to their name. So keep that in mind as we're going through these milestones. 6-month-olds also show curiosity and try to get things that are out of reach. So again, really wanting to explore their environment. Of course, the interest is more in people, but there's certainly different things that they're wanting to get to in their environment, whether it's a toy that's across the room or their mommy who's across the room. At 9 months old, babies are making a lot of different sounds, lots of those consonant vowel combinations, ma, 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 ba, 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 really trying to get some of those speech-like sounds into their repertoire. They've been paying attention to faces since 2 months, since before that even. They've been trying to imitate mommy and daddy's voice, starting at even 4 months, trying to imitate those movements. So they've really developed to now at 9 months, when mommy says ma, 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 I might be able to say ma, 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 ma right back to her and maybe even do it in that sort of pre-conversational back and forth. And if mommy, reaches up with the so big at 9 months, I might start to reach up my hands with that so big kind of gesture because again, I'm so cued into that social world. I'm paying so much attention to what those in my social environment are doing that I want to copy those sounds. I want to copy those gestures so that I can have that back and forth. Gestures are also really coming online at this point. So we've moved on from sort of the pre-gestures, if you will, to really starting to have some true gestures, such as giving an object to request. That's, around 9 or 10 months of age. We'll see babies, they've got something they can't open, they can't figure it out. They might try to give it to their mommy or give it to daddy to ask for some help. Babies at this stage are also starting to reach, even starting to reach to indicate. So I might reach up out of my high chair in order to get picked up. And then starting to do things like playing peekaboo. So if mommy, covers her eyes and says peekaboo, I might try to imitate that movement and cover my eyes with my hands or with a blanket in order to engage in that social game. Again, because that social back and forth is just so wonderful to me at this point as a 9-month-old, that I will just do anything to kind of continue that interaction. And the 9-month-old, really 9 and 6-month-old and younger, they're going to be pretty pushy to get that social interaction with mommy. If you're on the phone, that 9-month-old is going to be screaming for your attention, because if you're talking, they want you to be talking to them. So that kind of insistence or persistence on social interaction is something that we see and something that we want to see. A 9-month-old might even have some favorite toys at this point. So they might have things that they're preferring to play with. So really starting again to be engaged in their environment, engaged, moving and grooving a little bit more, so that they are truly connected to their environment and their social world. So at 12 months, this is a big milestone. And as a speech language pathologist, this is the one that I feel like, people are always starting, oh, well, 12 months old, that's first words. But in thinking back, we've already talked a good amount on some communication and on social communication in particular. And we're just now getting to 12 months. So we have to really be thinking about all those pre-linguistic skills that came online before we have that first word, whether it's just the interest in other people, that back and forth and attempting to imitate, and the gestures that are coming online. All of these things are happening before that first word happens around 12 months. So we'll keep that in mind as we move forward. So around 12 months, babies are starting to demonstrate some separation anxiety. They've had earlier on, they can notice who's mommy and who's not mommy. Well, now at 12 months, I really just want to be with mommy. I don't want to go to you, at my childcare provider. I don't really want to go to even grandma, maybe. I want to be with mommy, or I want to be with daddy. 12-month-olds are certainly using quite a lot of gestures with their words, and even if they don't quite have a word, they're certainly expressing themselves with their gestures. So they might have some symbolic gestures like shaking their head no to indicate, I don't want that, or waving bye-bye when they're leaving something, that really nice social gesture. A 12-month-old will be making sounds with changes in tone that sound like speech. So again, a 12-month-old has been paying so much attention to the other people in their environment that they know when mommy talks on the phone, it sounds a little bit like da 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 da. So they might kind of try making their speech sound a little bit with that sort of prosody, so that it sounds a little bit more like speech, and maybe even have some words kind of intermingled, mixed in with that little bit of jargon. A 12-month-old, as I indicated before, are starting to say a couple of words, maybe 1 or 2 words at this point, or even more. So they might say words like mama or dada or uh-oh. So words that they've heard lots and lots in their environment. Those are the words that are going to be coming out at this point. And they're going to be used in a social back and forth. So looking at mommy's face and saying mama. So really being connected in that moment and using that word for a communicative purpose. A 12-month-old also is going to start to look at the right picture or thing when named. So they might be able to, when you say, oh, we need to go get your shoes, they might look down at their feet. Oh, that's where my shoes go. Or they might even go looking for their shoes. They're really, that receptive vocabulary, their understanding is really taking off at this point. So following simple directions, go pick up that toy or give it to mommy. They might understand it at this point because, again, that receptive vocabulary is really coming online. A 12-month-old is also starting to have some of that great joint attention, and the gesture that we know that is so associated with joint attention is a show. So being able to show an object, or even point to an object, or point to something that the baby is seeing to draw another one's attention, that's something that we're going to see at this point. And that's a really important skill. But again, we have to think about all the skills that happened before that came into place. This baby is so engaged with their social environment and so, again, addicted to people and that back and forth with people, that social desire to share things that they think is cool is there, that they want to express that joint attention. They want to use their gestures to draw other people in. So at this point, one of the big themes that I hope you're seeing is that babies are more interested in their social world than their physical world. And they love, certainly there are things in their physical world, their favorite toys or things that they want to look at or interact with. but the way they want to look at and interact toys is through their social world. So they want to be able to bring other people into that really cool duck that they saw at the pond. So they might point to that duck and say, mommy, mommy, or duck, duck, because they want someone else to be in that moment with them. It's about that social world rather than just that physical world. At 18 months old, we see babies, really toddlers at this point, playing a little bit of the simple pretend, such as feeding a doll. So their symbolic knowledge has really, really grown, because 18 months old is also the point that we see that vocabulary burst really happen. So they're definitely saying several single words at this point. They're certainly pointing, as I expressed it at 12 months, that comes online. Now they're pointing all over the place. They're wanting to show others something interesting. They're wanting to request something. They're using that distal point where it's not, actually touching the object, but maybe even pointing up into the sky and saying, airplane, really wanting to draw other people's attention to something. 18-month-olds also know the function of several different objects. So they're going to be able to understand if you put a little phone on the table, a cell phone, they're going to put that to their ear and pretend to talk in it, or they might start poking around on it trying to open different apps, as iPhones are now. With a brush, they might take a brush and immediately put that to their head and start to try to brush their hair. With a spoon, they'll know, oh, I need to hold it by its handle, and we can scoop with a spoon, or we can stir with a spoon. I can feed a baby. And these are important because we know that in order to use a word functionally and truly have it as part of their repertoire of words, children need to know what the function is and be able to use that object to really understand what that object is, to have true word knowledge. An 18-month-old is also, I say can, not does, because an 18-month-old is going to have the skill set to follow one-step verbal commands without any gestures. That certainly doesn't mean that 18-month-olds just follow directions whenever we want them to, but they certainly have the receptive vocabulary in order to follow one-step verbal commands without that gesture support needed. So we don't need to point to the shoes when we're saying, go get your shoes. We can just give that verbal instruction and they can go from there. At 24 months, we're starting to see toddlers interested in other children and maybe even engaging in some parallel play with children, maybe starting to include other children just a little bit. You might see some chase games happening at this point. But the big thing we really want to see in these 24-month-olds, and even a little bit before, is watching and noticing their peers. So again, as we've talked about up till here, babies and toddlers are very, very interested in that social world. I'm interested in what mommy and daddy are doing. I'm interested in what another child is doing, so that when we're on the playground, I might expect a 24-month-old to want to play alongside a little boy who has a truck. If I have a truck, I want to have my truck next to his truck. I might crash my truck into his truck to try to start some sort of interaction. And we certainly wouldn't expect at this stage to have this beautiful back and forth sharing moment, because that's just not in a 2-year-old's repertoire. But we do want to see that interest in others and that ability to maybe notice what another friend is doing and try to imitate it, or try to somehow insert yourself into that play. 24-month-olds also are combining words, saying sentences with 2 to 4 words. So being able to express a little bit more complex things at this point. So being able to say, mommy work, meaning mommy's at work, or mommy's going to work, or, answering a question, being able to have a couple words together to really express a little bit more complex things. A 24-month-old also should at this point know names of familiar people and body parts. So being able to label body parts, being able to point out mommy and daddy, and even maybe grandma and different people that they're interacting with on a daily basis. 24-month-olds are also starting to have some of the simple make-believe games. And this is really when we see a 24-month-old maybe with friends pretending to go through the Starbucks line. If they're in the car with their mommy picking up coffee most mornings of the week, then they're going to maybe start to act that out a little bit and try out how that feels doing that, being able to kind of hold that amount of symbolic knowledge and truly pretend to have that little bit of an exchange. We see that happening as early as 24 months. It may not be super complex or even accurate, but they're really trying to kind of have those simple make-believe games come to life. A 24-month-old is also able to follow two-step directions. So again, we see that when children are combining words together, saying sentences with 2 to 4 words, and they're able to hold, again, a larger amount of symbolic knowledge in their brains so that they're able to do things like follow a two-step direction, go to your room and get your shoes, or, okay, go down the hall and find daddy, whatever it is, just those two-step directions, they're able to really do that at this point because of the amount of symbolic knowledge that they're able to hold. So in reflecting on all of those milestones that we were able to go over from 2 months until 24 months, you really were able to see, I hope, that unfolding of, again, addiction to the social world, addiction to people, just really wanting to be involved in that social world, and not as much interest, but certainly there, but more interest in the social world than the physical world. Very much engaged with that social environment. So that's something to keep in mind, again, when we're thinking about early red flags for autism. So now we're going to talk briefly about some of these red flags for autism. Excuse me. So when we're thinking about impairments in social interaction, the first thing that we think of, and this is certainly the first thing that a lot of people notice, is that there's a lack of response to name by 12 months. Now, if we remember back, and I know I pointed this out because I think it's an important one, even a 6-month-old with typical hearing, of course, is able to respond to their name by 6 months. So if we have a 12-month-old who's not responding to their name, that's absolutely an area of concern. Lack of appropriate eye gaze. Again, thinking back, 2-month-olds, 4-month-olds are very interested in our eyes and our faces and wanting to see what our eyes and faces are doing. So that lack of appropriate eye gaze is something to certainly be concerned about, because we want that interest in eyes. And of course, at Marcus Autism Center, we have a good amount of research right now on eye gaze and how that gaze to eyes is very, very important, and is one of those early red flags starting at around 6 months, when it starts to diverge, and the interest in things like the mouth and motor movement is more interesting to a child than interest in the eyes. Lack of sharing interest or enjoyment. And those lack of warm, joyful expressions. So those big smiles, those beautiful social smiles, that warmth that you feel from a baby smiling at you, if it's not there, that is an area of concern. Something to keep in mind with this, though, is that an infant or toddler with autism, or showing some red flags for autism, they certainly might have a beautiful social smile, but then you might not see it again for 5-10 minutes. So it might be that you're getting that warm, joyful expression, but it's not quite as often as you'd like to see it. They might be smiling at a toy rather than smiling up at you or up at mom or up at dad. So it's something to keep in mind, and we'll talk about that as we go through these red flags, that it's not a complete absence of these skills, it's a lack. It's a less often than we want to see them. So keep that in mind for sure. Certainly there's impairments in communication and language. So a lack of showing gestures or meaningful gestures by 12 months. So as we discussed in talking about development, we're seeing gestures come online as early as 6 months. And even before that, we're seeing some of those kind of pre-gestures there. But we should have a good amount of gestures, by 15, 18 months. By 16 months, we certainly should have 16 gestures. That's done by some work by Dr. Amy Weatherby at Florida State University. It's important to keep that in mind, because even our children who do have delays in their speech, so they're not having those the verbal language kind of ready to go at 12 months. They might not have those words yet. They're a child who is developing socially how we want them to. They're going to have different ways of sort of supplementing their speech. They're going to be using their bodies to communicate. They're going to be using their gestures. They may be combining those gestures with sounds to make their needs met. So if we have a child who isn't using their gestures, if they're not showing things to us and they're not giving things and reaching, that's an area of concern. We really need to be thinking about these gestures very seriously from an early age, because we know gestures are so important for language. And even if a child, again, if they're speech delayed, we do want them to be using their gestures. A lack of pretend play by 18 months, certainly something to be concerned about. Again, that symbolic knowledge is very important. And pretend play is also indicating that these children are noticing their environment, they're paying attention to that social world, they're wanting to imitate that social world, imitate events that they've gone through in their day, and that often happens in pretend play. So if a child is not engaging in that pretend play, it certainly is an area of concern by 18 months. Lack of coordination of nonverbal communication. So as I mentioned, even a child who is speech delayed, they are sure going to get your attention, even if they don't have a word. They're going to point and they're going to while they're pointing. They're going to make it very known what they need by using their bodies. And they're going to coordinate their sounds and their eye gaze looking at you and their gestures in order to make that happen. So that coordination is very important, because one thing that we do see as children is toddlers with autism, infants and toddlers with autism, might have some of these gestures, might have some of these sounds, might even have some words, but they're not coordinating these skills together. They're not pairing that eye gaze with that reach. They're not pairing that sound with that point or that reach in order to truly coordinate it and direct it to someone else. So we really need to pay attention to directed communication rather than just these skills as isolated skills. We don't want to just look at gestures. We don't want to just look at sounds or just look at words. We need to look at them all together, because that is the richness of communication that we need to be paying attention to. We also might see some unusual prosody, and that is an area of concern. So a little variation in pitch or an odd intonation, an irregular rhythm, or kind of a strange or unusual voice quality. This is important to keep in mind because, again, a typically developing toddler is going to be really checked into that social world. So they're going to hear, again, as I mentioned, when mommy talks on the phone, it tends to sound a certain way. There's kind of a melody to mommy's voice. And so a baby is going to imitate it in their speech. They're going to have that typical melody and prosody of their speech. So if we see a baby or a toddler who has speech, but it sounds a little unusual in its prosody, that's something to be concerned about for those reasons. And then finally, repetitive behaviors and restricted interests. And this is something that we often think about with some of our older children. We think about a child who's flapping, or we think about a child who, again, like in this picture, might be lining up cars, and that's what they just love to do, kind of repetitively lining up their cars or repetitively flapping. But when we're thinking of our little ones, when we're thinking about a 12 to 15-month-old, or even as young as 9 months, this might be something more akin to a sticky attention. So if we have a child who has that sticky attention, really paying attention to maybe a jar of food, that they're holding it in their hands and they're looking at the bottom and they're examining every little aspect of that jar. They've got that focus on the object, and maybe even have a little bit of repetitive movement with it. So they're starting to spin it around in their hands. It's very subtle at this age, but that is a repetitive movement, and that is a restricted interest. That sticky attention to objects absolutely falls into this restricted interest. We also are going to see some of this repetitive movements, as I mentioned, the flapping, but there also might be some just stranger posturing of body, arms, hands, or fingers. So a child who's holding their hand in a bit of a stranger way. There's a little bit of a posturing. Maybe their arms are flared out just a little bit. Their fingers are. These are things that we need to be concerned about when we're watching a child play. Again, that is some of those sort of pre-repetitive behaviors that we need to be looking out for. It's difficult to see at this early age because it's very subtle, but we're learning more and more about this. So again, when we see a child who's got more of that interest in the physical world, interest in objects rather than people, these are things that are pre-repetitive behaviors and pre-restricted interests that we need to be paying attention to because as I feel like I'm just a broken record about it, we want babies to be more interested in the social world than the physical world. So to kind of sum that up into review, in typical development, what we're seeing is things like response to name and being able to shift gaze. So using lots of gaze to face, but also being able to quickly look down at an object, look back at mommy, look back down at that object, look at daddy looking over there. We're going to be able to shift gaze pretty easily. Whereas an early red flag for autism may be, again, that gaze aversion or that sticky attention to an object and wanting to keep that gaze on the object and maybe only looking up every now and then, but not having that richness. That lack of response to name, again, something we certainly need to be looking at because we would expect that to come online as early as 6 months. Having that orientation to speech, we certainly would expect children to be and toddlers to be much more interested in what mommy's talking about than that object. So if a baby has or a toddler has limited response to speech, and again, it's just focused on that object, that's something to be concerned about. Certainly with our gestures, pointing being a big gesture because that is our one of our strong joint attention kind of gestures, pointing and showing. Those are going to be things that we might not see in an infant or toddler with autism. And again, it's not an absence, it's a lack of or just less than we want it to be. As I mentioned, affect sharing compared with object focus. So when something's cool, a typically developing toddler is just going to be big smiles, sharing it with an adult, sharing it with anyone who will listen. Whereas an early red flag for autism would be that object focus. So I might be interested in something and think, wow, that's super cool, but I'm going to smile at the object rather than share that interest. So that limited caregiver referencing is something that we're going to see, not as interested to share that very cool thing or kind of check in with mom. That's something to be concerned about. We would have a lack of imitation. And a lack of some of this joint attention, as I mentioned. So whether it's responding to or initiating joint attention, again, it's kind of all these things are encompassed in that social back and forth that we want to be seeing. We're going to have limited skills when we're seeing early red flags for autism. And then certainly symbolic play is going to be a delay and an early red flag for autism if we don't have that symbolic play around or after 18 months. So again, we have to look beyond the typical speech milestones because we know that there is a basis for social communication well before words come along. So where do we go from here? We can say we're starting to identify these early red flags, we're seeing concerns. So what do? Well, the National Research Council in 2001 and in more recent iterations has recommended that children with autism receive 25 hours per week of active engagement in systematically planned, developmentally appropriate educational activities. 25 hours is very daunting. It sounds very daunting to families. But the way we want to start embedding these 25 hours, that's what's really, really exciting. We don't need to be thinking about 25 hours directly sitting at a table working with a clinician. We need to be thinking about newer ways of embedding these 25 hours within an infant or toddler's everyday lives to truly make it meaningful and developmentally appropriate. So we need to be thinking about this in terms of early intervention because again, if we're catching these children as early as 12 to 15 or 18 months, we need to be thinking about intervention that's occurring in the home with the families involved so that we can promote that development as early as possible. So why early intervention? There's certainly several reasons that we would want to have early intervention. Of course, to enhance a child's development, when we start seeing these delays, we need to be working, okay, how quickly can we get this child to gain these skills that they might be lacking to truly promote their development? Of course, to provide support and assistance to the family and to maximize the child and family's benefit to society. Because something that we do know is that those 25 hours of engagement, when a child or a toddler is actively engaged for 25 hours per week, those children do better in kindergarten. That's very important for future development because what we know is before the age of 3, we can really change developmental trajectories with early intervention. We can actually promote brain development. We can change change neural development. We can start new connections in brains. It's incredible what we can do with early intervention in these first 3 years of life. To say that we're absolutely really changing the trajectory of autism this early on. So it's so important that we engage in early intervention. And then finally, to develop these strong everyday living skills for later in life. So thinking about self-help skills, thinking about this from an early stage. And again, when we're thinking about early intervention, we're thinking about changing those neural pathways. So we really are changing that focus on objects to the focus on people. So if a child maybe was just a passive participant in something like a diaper change, why wait to work on that until we're 5, to work on pottying and self-help skills at 5? Let's work on it at 12 to 15 months. Let's get those self-help skills on now. We can truly get that child cued into these everyday activities from an early stage to truly change their development completely. So in terms of our perspective, historically, when we're thinking about early intervention, there was this emphasis on family-centered practices, which included caregivers in decision-making and then establishing goals. But more recently, early intervention systems have advocated a broadened perspective on family-centered practices to have an emphasis on caregiver-mediated intervention. So really starting to think about the reality of a clinician might only be out here 1, 2, at best 3 hours per week, but a parent is with their child all day long, or at least for many more hours than a clinician is. So caregiver-mediated intervention is really the future. So to compare clinician-mediated versus caregiver-mediated intervention, we're going to take just a few moments to talk through the differences between these different types of intervention. So clinician-mediated intervention. In clinician-mediated intervention, the clinician is educating and informing the caregiver. So really truly being the expert and providing information to that caregiver on what's going to be best for their child. The clinician is going to gather information on the caregiver's priorities and concerns and infuse those priorities and goals into their treatment as it's applicable. The clinician is definitely going to be implementing the treatment plan in terms of, what are we going to be working on? What's this going to look like? What are these activities going to be? The caregiver is going to observe. As you can see in this picture, the clinician is directly working with the child, and the caregiver is certainly part of that triad, but they're more of, at this point, sort of a passive observer. What can I learn from that clinician? How should I do peekaboo with my child? I'll watch the clinician to see how she does it, and then she can give me the instructions on how I should do it. So the caregiver is then sort of implementing that home program. They're given homework of, this is what we should be working on this week. So we're going to take that instruction that I've gotten from the clinician and be able to infuse that into our lives. The clinician is then tracking the progress to make sure that the child is making the progress that she would like him to be making, to again try to make up the delays that child has. So the other side of the coin, and what we're trying to move towards, but that is very challenging, certainly has its own challenges, is caregiver-mediated intervention. So this is truly a partnership between the caregivers and the clinician, and it's truly family-centered with collaborative planning going on. So the clinician is going to truly gather information from the caregivers. The caregivers are going to be, and are, the expert on their child. So the clinician might sit back and say, show me how diaper changing goes. Show me how book reading goes. And that clinician can then gather information on what supports that caregiver is already providing naturally to their child. Then the caregiver and clinician then can have a consensus building conversation. They can kind of try to get on the same page. So the clinician certainly is going to guide and educate that caregiver on, oh, this could be a great next step, or, whatever it might be in terms of really kind of maximizing on opportunities, but it needs to be within this consensus building conversation. It needs to be that both the clinician and the caregiver have a seat at the table. And the caregiver has a little bit of a bigger seat at that table. They're really driving the train when it comes to their intervention. Um, and this is very important because what we're seeing in research is that when caregivers are driving the train of their child's intervention, when they are really in the front seat, when they're really the ones who are the interventionist to their child, or really just, the mommy to their child, that they have more buy-in and that these children are easily able to get those 25 hours of active engagement because the parents are able to infuse supports and strategies into their everyday activities. They're able to see that diaper change is very productive time for their child, very actively engaged time, and they're able to work on those self-help skills. That clinician might learn something from the caregiver. There might be a song or an activity or a way that this caregiver does snack that is so incredibly engaging and for this child that it's much more beneficial than that ring around the rosy that the clinician might have wanted to do with the child that day or bubbles that they might have wanted to do. Whereas when they sit back and really listen to that caregiver, they're able to see all the skills that the caregiver brings to the table and then infuse some of those intervention practices and strategies into that activity. But again, through that, really joint planning and consensus building sort of conversations. So how can we build caregiver capacity? Early intervention providers can build caregiver capacity by strengthening that caregiver-child relationship. That's very important. And, there's many ways to do that. Excuse me, but even just certain ways, certainly doing things like increasing that caregiver's confidence when they're working with their child. Just simply sitting back, observing the caregiver-child dynamic, and being able to give some of that great positive feedback of, wow, mom, when modeled stacking those blocks for your child that one more time, he really was able to join in on that play. When we can give caregivers that feedback that they truly are supporting their child's development so well and that they know their child better than anyone else. They're truly the expert. That's going to help to build their confidence and also help to build that caregiver-child relationship that we know is so important. And then finally, accomplishing family identified outcomes. So if mom and dad have a goal that this child is going to be able to transition into their car seat so that they can pick up brother from baseball practice, then that's what an early interventionist needs to be working on, is that transition. Whatever outcome that parent is really looking to do, we need to help build their capacity by supporting them through what really is a priority for them and finding ways to maximize on those opportunities. If they've got a priority that even, book reading, they've got to get through this book because they read this, The Very Hungry Caterpillar with their older son, and that's a priority for them. Well, then as an interventionist, we are going to make that happen. We're going to support that toddler's learning and engagement through that book because we want to build that caregiver's confidence and build their capacity by really meeting their goals for their child. And then the role of early educators and community providers. There's several different strategies that we can be thinking about for early identification as an early educator or a community provider. Because again, as I mentioned before, as an early educator and a community provider, anyone who's interacting with these infants and toddlers on a daily basis, it's our job to be monitoring these children's development and to be even thinking about some strategies that are going to help these children. So again, some of these strategies, as I mentioned, monitoring development, being able to implement some classroom strategies. And we really want to be thinking about these strategies as ways to promote engagement for all children in a classroom and promoting social communication development for all children, because we do know that all children benefit from social communication supports. Being able to coordinate services and really collaborate with other professionals. We never want to view the roles of early educators and community providers as being within silos. It is our job as early educators and community providers to reach out to other professionals so that we can coordinate and collaborate so that we can best support families. We need to help families access the resources that they need. We need to be helping them to support their concerns and meet their priorities for their child. We need to plan and support implementation of services for families and help to coordinate with interagency services. And then finally, and maybe most importantly, we need to serve as an advocate for children and families. If we have a concern, if a family comes to us with a concern, we need to be their advocate. We need to fight for what they are fighting for, because parents need that support. And children need that support. So we as early educators and community providers need to empower ourselves to be advocates for children and families. So to summarize what we've discussed today, the link I have here is a link to Learn the Signs, Act Early, which I really do recommend anyone and everyone using these resources, directing families to use these resources. They're very, very beneficial. They get into not only social communication development, but of course motor milestones as well, so that families can really track their own child's progress. And again, that's building capacity in parents to be able to track their own child's development and be able to know when something is a reason for concern so that they can advocate for themselves to their pediatrician, to their providers. It's very important to have these resources at hand. So that's a great one that's free and available to everyone. Again, broken record about this one, but I'll say it again. Success at early screening and detection depends on frontline providers and caregivers. So no more as an early interventionist or an early teacher, or early provider of any kind can we say, I don't know much about autism. I don't know much about social communication development. We can't say that. When the prevalence is 1 in 68, we need to empower ourselves with that knowledge. We need to be the advocates for these families and these children. So we need to take that as a responsibility that we are going to be at those frontline providers who are going to be successful at this early screening and detection. Because we know that intervention has the greatest impact. We can make the biggest brain changes on autism if this intervention begins before 3 years of age. And we have to move away from that statistic that 80% of children who need early intervention are missed. Also, to summarize, the early intervention system is now advocating family-centered practices with an emphasis on caregiver mediated intervention. And as we'll see, that research is going to continue to delve more into caregiver mediated interventions. And when we think about cost effectiveness, and when we think about just effectiveness of intervention and making changes, getting to those 25 hours, all of that coming together, we know that caregiver mediated intervention is going to be our way to get there. So thank you so much for listening today. I hope that this was a beneficial presentation. I appreciate you all listening. And if you have any questions at all or want to share ideas, I'm always open to that. Please feel free to email me. You see it